Hi, I'm Barbara Lee, the Sex Minister, and I'm here in Detroit at the North American Interfaith Network Connect Conference with Peter Cooper. Peter is a member of a Jewish community.
Congregation Tahir, Reconstructionist Jewish, yes.
Wonderful. And also has been a volunteer in the HIV and AIDS movement for several years. Tell me a little bit about that work.
Well, I've been both an employee professionally and I've worked as a volunteer with HIV AIDS for the last 32 years approximately. I started when we first started doing HIV work here in the Detroit area. I've worked with AIDS Partnership Michigan as a new intake specialist. I've worked on the Michigan AIDS Hotline. I've been a board member and a lecturer with the Michigan Jewish AIDS Coalition. I've worked with the NAMES Project, which is the AIDS Quilt. And I've just done a variety of different volunteer and professional work in and around the Detroit area and Washington, D.C. So I've been doing this for quite a while.
Wow. So what are some of the new things that we need to know about on the front of treatment for HIV and AIDS?
Well, HIV is 100% preventable, but it's a matter of preventing it. Once you've contacted HIV, you have HIV for the rest of your life. If it's not treated, HIV eventually can become what we call AIDS, acquired immune deficiency syndrome, and at that point the body breaks down, you become very sick, and it's possible that it can kill you. So it's very important for people who are HIV negative to protect their HIV their negative status as much as possible and to prevent contacting HIV. For those people who are already HIV infected, it's very important for them to be seeing a medical doctor who's experienced with HIV issues and to be taking medications that can help keep the virus undetectable as long as possible. There's no reason why with proper medical treatment that a person who's HIV positive cannot remain healthy for years and years to come. The problem is with many of the medications is that we really don't know what the long-term effects are of those medications. Somebody living with these different medications for 10, 20, 30 or more years. We just don't have anybody that's been living on these meds for that long. The virus itself, as we know it, is only 32 years old. So we don't know exactly what the cause and effect of these medications are going to be in the long run. Right now, they're saving people's lives and we're glad of it. But the emphasis still is, if you're HIV negative, you want to protect that HIV status.
And you do that by making wise choices about your sexuality, about your sexual partner, and about your sexual practices in terms of safe sex.
Absolutely. There's no such thing as safe sex. The only safe sex is no sex.
Which is not really a realistic option for most of us.
So what we call is safer sex. That is taking advantage of the different methods that are out there to help you prevent contacting HIV or from spreading the virus if you're already HIV infected. It's very important also that you respect your own body. We don't want people to be afraid of their own bodies. We don't want people to be afraid of their body functions. We certainly don't want people to be afraid of sex. Sex is a very natural, normal part of the human condition, and as you do so well in your books to explain that sexuality and spirituality go together hand in hand. It's hard to have more people without one or the other. They work together. But as I said, it's very important that we not be afraid of our own bodies, but we need to respect our bodies as well. We need to know what causes HIV and how to prevent it. And as I said, HIV is 100% preventable. There's a variety of different ways that we can do this. One way, of course, if you're in a relationship already with somebody who's HIV negative, if you're both HIV negative, you can't give something to someone you don't have. So if you're in a relationship now with somebody who's HIV negative and you're HIV negative, as long as you maintain a monogamous relationship and you're not seeing other partners, you're not going to infect the other person. You just can't do it.
Sure.
If at some point one of you decides that you want to have sex with a third person, either with the consent of or a lack of knowledge of your partner, then you've placed yourself and your partner at risk. But as long as you're in that monogamous relationship, like I said, you can't give someone something that you don't have. If you're not in a monogamous relationship, if you're in seeing partners or a partner whose sexual status, sexual HIV status you don't know or not sure of, then you need to take responsibility for yourself. Ask the difficult questions. Don't just ask someone if they're HIV positive. They may not know themselves, but if you ask them, when was the last time you were tested? That's something they can give you an identifiable answer for. If they haven't been tested in years, or if they've never been tested at all, that should be a red flag. That doesn't mean necessarily that they are HIV positive, and you don't want to put a stigma on them. But if they haven't been tested, they honestly don't know, you need to make the assumption that there's a possibility that they could have been infected, might not know it themselves, and you need to take the personal responsibility to protect yourself. That means you either practice sex in such a way that you're not going to exchange body fluids, that you use a condom when you're having anal or vaginal sex, or there's a new program out that now it's called PrEP, P-R-E-P. I'm not certain exactly what the initials stand for, but we found out that one of the medications that's been used to help people who are HIV positive already, to help keep the virus under control, called Truvada, if taken by a person who's HIV negative, and if it's used consistently and correctly every time over a period of time, it can actually prevent the spread of the virus if you're having sex with a partner who's HIV positive. And it's shown to be very effective. So a lot of people are looking forward to this now. The problem with PrEP is that, first of all, it's extremely expensive unless you have some type of insurance or a very big bankroll to be able to pay for it. PrEP only prevents HIV. It does not prevent other sexually transmitted diseases. It does not prevent venereal warts. It does not prevent pregnancy. It only prevents HIV. So even if you're using PrEP, we still recommend that you use a condom as well to protect you from the other possibilities.
Sure.
Of course, a lot of people don't like that because their rationale is that they really want to have sex without the condom, but they need to be aware that these are still possibilities.
And there still needs to be that active role and responsibility as
Absolutely.
opposed to delegating the responsibility to the pharmaceutical companies.
Or delegating that responsibility to your partner or to anybody else. Again, we don't want people to feel like sex is something that they have to be afraid of. We don't want people to feel like their bodies are something they have to be afraid of. But they need to be responsible. There's a big difference between taking responsibility and being afraid.
Absolutely. Well, thank you, Peter. I'm glad that you're here. I'm glad that we're able to share this time at the North American Interfaith Network, exploring the intersection of sexuality and spirituality. And I invite all of you to love your bodies, to relish sex, and to marvel in this very good gift. Namaste.
Shalom.